This is Tom Lee, editor-in-chief of NEJM Catalyst, and we're going to be discussing today what is it like for a physician to get coaching. I recently met Scott Friedenberg, the vice chair of neurology at Geisinger Health and the director of neurophysiology and neuromuscular disease. He described the experience of having a coach work with him on his patient interactions. And to be honest, I had a mild anxiety attack imagining what it would be like to go through that. Scott reassured me that it would be just fine. And I thought he might do the same for the rest of you out there. And I was delighted when he agreed to join us. Scott, let's start by telling the audience, concisely a bit about you and your role at Geisinger.
Sure. As you said, I'm the vice chair of clinical practice and run our neuromuscular group. And recently I've stepped up to being director of our health system sciences practice, or our department, which really we have a very simple goal is to teach people how they can apply health system science concepts to their day-to-day practice. So I think this idea of coaching actually fits in very nicely because it's trying to figure out how to take things that we've read about and we understand as how you make your practice better, but actually applying it in the clinical environment. And I found a coach was really very helpful in bridging that gap between understanding what I should be doing and actually doing it.
Okay, so because of your roles, it's clear you're experienced and you're a leader at Geisinger. Those are both things that tend to make physicians feel like, I don't need coaching. So how did the idea actually come up for you? Who brought it up? And, and what was your reaction? And why did they bring it up?
Great point. And I would agree. As I mentioned when I did my original presentation, I love me. I think I'm awesome. I think I do a great job. And a couple of years ago, when Geisinger started looking at patient evaluations that they could put in online, it started off with some evaluations that weren't perfect, but they said things like maybe I didn't like the wait for my appointment or scheduling was difficult. And I don't think I really took ownership of it. But as these evolved, I realized if I wanted my patients to have a better perception of me, I had to figure out something, but I really wasn't ready to pull the trigger until I got a call from a lawyer without making it too much of a long story. A nurse practitioner I had worked with who was very capable had done a procedure on a patient or was going to do the procedure, and the patient preferred that I do the procedure. The reality is I don't know how to do the procedure. The AP was doing it. And the patient complained to the state. And so I was involved in an action, maybe not a suit, but an action. So I suddenly was faced with this threat of a legal action for something I hadn't done, had nothing to do with, but I realized my practice itself, I had to take ownership of the whole practice. I couldn't just be owning that one room and what happened. So I had to learn to do things better.
So how did the experience unfold for you? Like what actually happened with the coaching and were there moments that made you cringe?
Oh, absolutely. Somebody at our health system actually had contacted me as well as part of this process, and they said, would you, how do you want to remediate this? And I said, I don't know. And they said, well, we have coaches. And of course, I thought, do I need a coach? I've had sports coaches, I've had professional coaches, but coaching on how to deal with patients, it felt like they were stepping into my private sphere, but it turned out to be remarkably comfortable. The coach, she came in and sat down with me ahead of time. And really, I had the impression that the goal was to fix me, but it turned out the goal was to highlight what I do well and suggest I do more of it, and to identify things that maybe I could do better and brainstorm how to do better. So it wasn't, I really envisioned like being told what to do, but it was really somebody helping me understand my practice and develop some novel ideas using her expertise to guide me. So the cringe factor really was, to be honest, being open enough with somebody I really didn't know to show them what I was doing, to have them actually come into my clinic and observe me seeing patients. So I had to let that big cringe for me, I think, was letting somebody into my world that I felt I had a good control of, but obviously there were some indicators that said I could do better.
Just so we've got a feeling for the mechanics, like what did you tell the patient when a coach was going to come into the room with you?
I'm be honest, I just told them straight away. I said, I've got a person here, Dr. Reeder. Dr. Reeder's coming in with me. She's an expert in patient communication, and I'd like to be working on my improvement of my communication. Do you mind? I was very honest, and I just said this is why they're there. Um, I didn't figure there was any other way around it. I couldn't tell them a lie.
And did any patients ever object?
No, no, not at all. In fact, it was very reminiscent of when I was a medical student and I'd have direct observations or as a resident where the staff would come in and the patient just talked to me as if the staff or Dr. Reeder wasn't even there. It went super smooth, which I don't know if I was nervous about the patient seeing it. I was nervous that it would change my behavior, having me being directly observed. Probably nice that she was there the whole day because it gave me a chance to kind of get comfortable with it. So I will admit at the beginning, I was effusive with my positivity and trying to put on my best face, but by the end of the day, I was my regular self.
Can you give me a feeling for how it has made you better?
It certainly gave me insight into the part of the patient's life that I didn't really think about. And as a clinician, I understood paying attention and listening to their medical problems. I understood paying attention and listening to their social determinants and their needs, but I never really thought much about the mechanics of our practice, like how everything that happens to that patient before they get to me impacted their care. In fact, I honestly had a bit of a dismissive attitude before this. If some of my patients said to me, I've been waiting in the waiting room for whatever, or they didn't do this, my mindset was, okay, I'm sorry, let's move on to your medical issues. So in one way, it really helped me recognize a black spot that I had or a black hole I had in my vision, which was I didn't think about the patient care, their patient journey. The second thing it did is it certainly helped me recognize that if I had a good coach, it was okay and it was safe to be honest. It's sort of like the garbage in, garbage out. If you don't tell your coach really what's going on, they're going to coach you or mentor you on a partial truth. So it helped me be a little bit more candid, maybe a lot more candid.
It actually sounds like knowing someone was watching you helped you watch yourself.
Yeah, that's a great way of putting it. It forced me to be introspective and observant in an area that maybe I'd taken for granted. Um, I forget who wrote it. There's a great article about a surgeon who had somebody come in and supervise him, an endocrinology surgeon who's a great writer. I can't think of his name. Um, and he said he had a surgeon come in and observe him, coach him, and he came up with like 50 things he could do better, even though the surgeon felt he was good. I think having somebody observe you makes you observe yourself better, but it also allows you to be yourself so they can use their lens to help you see things better.
I'm 99% sure that was Atul Gawande.
Yes, exactly. I knew it would
Yeah,
come. That's it.
yes. And he said having someone watch him was the most excruciating thing he's ever been through, but it was so good for him.
Yeah,
So,
totally agree.
so do you think this is something everyone should do? I know everyone doesn't want it. How do you think about getting people in a coachable frame of mind?
That is a tough question. And I have to be honest. If I had been asked for this type of a coach, and I've been in practice for 25 years, 10 years out of training, I don't know that I would have been ready for it. I think it's easy to say, oh, somebody who wants to be better and improve things, a coach is the right thing. Um, but really, my sense is you have to have a heart to recognize you might be part of the problem. And maybe that's a little bit too honest, but I had to accept the fact that even though a patient was unhappy about something that had nothing to do with me, really, I couldn't solve a problem unless I accepted I was part of it. Because if I didn't say I was part of it, it's a lot harder to fix other people than it is to fix me. So if I can figure out a way to make me better, I can hopefully solve the problem. If my goal is to fix other people, that's, as a leader, I found that is a tough challenge. So maybe that's just the short answer is make sure you realize you're willing to see yourself as part of the problem and you want to fix it.
Well, listening to you, I feel like it's wonderful that you're so secure emotionally that you're ready to try to improve. And so trying to make people feel safe is probably part of the work of getting people into the mode of improvement. Well, that was my hope in bringing you onto our program. And I think that the way you describe it will have some real impact on a lot of our colleagues. And I know that you will continue to learn about what will help you be better, and your patients will benefit. And I hope that our readers will benefit too. So we'll be coming back to you, I'm sure, in one way or another. Thank you so much for joining us, Scott.
Yeah, absolutely. It's a pleasure to be invited.